Hello everyone, I am urologist Omar Makaya. Today we are going to talk a little bit about Botox injection. Botox is not only used for cosmetic purposes. So it is not only used for facial wrinkles. Botox has many uses. Botox treatment of the penis in urology is one of the alternative treatments for erectile dysfunction. In the last 10 years, many publications have started to appear about it. We need to explain briefly what Botox is. This is a standardized substance made from a bacterium called Clostridium botulinum and placed in a vial. You dilute it and inject it into the area you want to treat. Paralyzes and relaxes muscle cells in the area you apply. One of the most important problems of penile erectile dysfunction is that the muscle cells in the penis, which we call the cavernous body, cannot relax. This is already the biggest problem. Botox injection was started to be applied in treatment, thinking that it could relax this, that it would be good for erectile dysfunction. It has been practiced for about 10 years. There have been many publications. The last good publications came out in 2022 and 2023. Between 2017 and 2022, 216 men received Botox injections. They divided these men into 3 groups: patients suffering from mild, moderate and severe erectile dysfunction. The results of the study are very good. In patients with severe erectile dysfunction, around 69% improvement was detected with Botox injection. 75% in patients with moderate erectile dysfunction, and 85% in patients with mild erectile dysfunction. As you can see in the graph here, they detected an improvement in complaints by almost half, especially in those with advanced complaints. After 8 months, when the second injection was given, the symptoms improved even more. Those with moderate complaints responded very well. Why do we call the response very good? What are we comparing it with? The response that patients normally get in Viagra applications normally varies between 70 and 80%. The patients who applied it had a response like Viagra or sildenafil citrate. The results are good. At the moment, Botox injection for erectile dysfunction is still not fully in place in our treatment guidelines. This will become even more relevant with the studies. How is Botox injection application performed? It is done in the office, no operating room is required. A numbing cream is applied on the penis followed by Botox injection into the penis. The total procedure takes about half an hour. After the procedure, the patient can get up and go home. He can return to routine life the next day. A Botox vial costs around $200, the procedure fee is around $100 to $200, so the total cost is around $300 to $400. Let me give an example from my own clinical experience. We had patients with advanced complaints, who could no longer respond to Viagra, who had previously undergone shock wave therapy, PRP, stem cell therapy. We were considering them as candidates for penile prosthesis. In other words, these patients were not responding to the treatments in any way. When we injected Botox into 10 such patients, we saw that 6 out of 10 patients were now able to respond to Cialis and Viagra. It really is one of the more viable alternatives. The main disadvantage is that the duration of treatment is around 8 months. So with the second injection, the patient is in a state of well-being for a year and a half. In fact, it is not so bad after the second injection, the patient gets a better response than the first injection. In general, Botox injection in this way, I see it as one of the alternative treatment options for patients who do not respond to other treatments for erectile dysfunction. If you have any questions about this, you can contact me on WhatsApp. Thank you for listening, best regards.